Make sure your strokes are overlapping. And when you get up to the premolars, you choke up on your instrument a little bit and get your fingers closer to the tip. Mandibular left lingual, you're actually fulcruming on the premolars. Make sure your patient is in the mandibular position. You're going to come around to 10 and swap ends to do the surfaces away from you. Still fulcruming up around the premolars. And then when you get to the premolars, you're going to be fulcruming very close to the area you're working. Okay, and then for the linguals of the right side, extended shank again. Whole hand still moving as a unit. Okay, and your position is 10 to 11 there, and also for the surfaces toward you, position would be 9, 8 to 9. Okay, now for maxillary. Maxillary surfaces toward you, make sure that you move your patient. With the typodont, the chair will look like it's extremely far back, but because their chins don't go back, you kind of have to do this. But make sure that you do lean your patient back so that you have direct vision from 9 o'clock on these surfaces. And again, a lesson in checking for your end. Whenever you have the correct end, you pick up the instrument and it will smoothly just go right around the mesial of the tooth, and when it gets in there, the bend is pointing toward the distal. So we come up with an extraoral fulcrum. And of course, you always start the distal line angle and go distal, and you will be using this instrument strictly posterior here in the clinic. And this is the Nevi. Now when you get to the premolars, I didn't do it there, but you should go ahead and use that intraoral fulcrum, okay? For stability purposes. So the extraoral fulcrum back here is going to be more of a cupping the chin. Hand still moving as a unit, no independent finger motion. And then when you get up to the premolars, you enter oral fulcrum. Okay. Then the surfaces away from you. Make sure and turn your patient toward yourself. Use your mirror to retract the cheeks. Using the extraoral fulcrum on the molars, start the distal line angle and go distally. And then you come on around to 11 to do the premolars, fulcruming very close to the tooth that you are working on. Okay, and then for the linguals of the upper right, extraoral fulcrum down here, extending that shank, starting on the distal line angle, going distally, and then starting distal line angle and coming mesially. Making sure that your strokes are overlapping. Oops, I started using that intraoral fulcrum. Keep using the extraoral until you get up here on these premolars. There you go. Use the intraoral fulcrum. And that's the Nevi.